Right. Well, welcome to the webinar, Disaster Response, Reaching Those Left Behind. Before we begin, all of us at the Medical Society Consortium on Climate and Health respectfully acknowledge that our advocacy, education, and learning across the country takes place on the occupied and unceded lands of many Native American tribes. To acknowledge this land is to recognize its long history and our place in that history. It is to recognize these lands and waters and their significance for the peoples who lived and continue to live in this country and whose practices and spiritualities were, are, and shall always be tied to the land and the water. Today's webinar is the fourth in our 2023 Climate Justice webinar series as part of the Climate and Health Equity Fellowship Program. The CHEF Fellowship is a program that recognizes the need for more diversity in climate and health leadership and a sharper focus on equitable climate solutions. The goal of the fellowship is to empower doctors of color from populations that face greater burdens from climate change, climate effects, and are underrepresented in medicine to become leaders in climate and health equity, education, advocacy, and policy solutions. I'm Dr. Shanita Johnson, the Deputy Director of the Climate and Health Equity Fellowship Program. Also joining me from the consortium to run this webinar, our Program Manager Jordan Curry and our Program Assistant Clarissa Payton. They will be available through the chat to answer any technical questions during this webinar. Our other team members on the webinar are Program Director Dr. Mark Mitchell, Associate Director of the Western Cohort Dr. Venice Curry, and Program Manager Dr. Kimberly Williams. This webinar series is hosted by the Medical Society Consortium on Climate and Health, and it is held for 1 hour on the second Friday of each month from 3 p.m. to 4 p.m. Eastern Standard Time. Today's webinar will be recorded and made available on our website for future viewing as part of the Equity Resources page on the Consortium's website. This year, we are pleased to offer CME credit for our webinars. Instructions on obtaining credit will be provided at the end of the webinar. Today, we are honored to have Dr. Armen Henderson, 2021 CHEF Fellow and Assistant Professor of Medicine at the University of Miami and an internal medicine physician, as well as Moriah Washington, Director of Community Engagement at the New York City Emergency Management Department. Rather than using our time to provide further description of their impressive work, we are placing a link to their bios in the chat. As a healthcare provider, it is important that you consider the role that healthcare systems and providers play in regard to climate and health. In this webinar, Dr. Armen Henderson will talk about the effects that disasters, such as extreme weather events, have on disadvantaged communities, problems with the current disaster response system, and his program to engage health professionals in responding. Moriah Washington, Director of Community Engagement at New York City Emergency Management, will report on culturally specific solutions to emergency response the department makes available to their residents. The general format for today's webinar will be two 20-minute presentations by our speakers, followed by 10 minutes of questions and answers from our audience. We ask that you please put comments, links to any resources that you may recommend, or any questions that you may have for the presenters in the chat box at any time during this presentation. We will get to as many of the questions as we can. Please keep yourself muted so we are not interrupted by background noise. We will begin with Moriah Washington. Moriah, you may begin.
Good afternoon, everyone. Thank you so much for having me. I think this might be maybe the third cohort that I've had the opportunity to speak to, and it truly is a pleasure. I just want to confirm you're able to hear me clearly. Yes, ma'am.
Yes, we are.
Okay, thank you for that. I don't know why this Friday is so busy, but it has been a busy bee Friday for me. I tried to keep it light, and it wasn't the case. I was sent the topic of reaching the underserved and those who may be left behind. And I have slides, and I want to not be tethered to the slides. And I want to have a conversation with you all and kind of share out what we do at New York City Emergency Management. In my work as a director of community engagement, the team of four of us, we get to work with the coalitions and faith-based groups throughout our 5 boroughs of New York City. We know that it's an average of maybe 8.9 million residents and counting in New York City. And when a day of commuting, that number goes up easily to about 15 million folks who are in the city of New York. And so often every county, every city, in every state, they have emergency plans for what will happen in the event of fill in that blank. You name the emergency. When I'm using the word emergency, it's something that's going to be tied to weather. It could be man-made, it can be infrastructural, or it can be like we had this air quality emergency where we had the scariest of haze hit the city and we all were looking over our shoulders like, are we going to survive? And then waking up the next morning and literally just experiencing smoke all in my, oh, Dr. Watkins, I think, hey, I need to focus. I remember you. Sorry. But having smoke all in your space, but still proceeding throughout the day. So while we get to work with coalitions, it comes to how did we get a diverse group of coalitions that we work with and what do we do? And I wanted to be very honest in saying a lot of how we reach the underserved and those who may be left behind is when there is that emergency, we hear from that community, no one reached out to us. And then we say, hey, we don't want that to happen again. Let's make the connection. Let's establish a relationship. One of the most recent examples is our group, Gambian Youth Organization in Bronx, January of 2022, excuse me. There was a major fire that took out half of a whole building with hundreds of residents and displaced over 100, maybe 200 folks. And what we realized, it happened to be a community dense with folks who speak Wolof of specific dialects from Gambia and a couple of other different countries. And so we were making all these different decisions. We were sending out interpreters and realizing, oh, this interpreter doesn't speak the right dialect. So I said to my executives, like, do you mind if I go to the ground? I have a contact. Let me just go on ground and really see what's going on. When we think about reaching the underserved, you often wonder, what type of situations do I have to be in? And will I be uncomfortable and safe? I'm walking around the community, and before I know it, my friend Hattie was like, oh, Moriah. I'm like, yes, what's going on? She's like, we're going to speak to the imam. So the imam is the leader of the mosque. Or for those who might be of Christian faith, it's the pastor of the church, but for the Muslim community. And I'm like, okay, like, absolutely. I don't mind meeting the imam. She's like, oh, but we got to cover your head. And I'm like, oh, you should tell me I don't have anything. So we scrambled around, got a head covering, covered my head, took off my shoes. I go into the space. But what I didn't expect was that I would sit in a seat and then the imam and his leadership team, all men, were kneeling before me as I sat in a chair. So I'm elevated and they're before me and they're looking up to me and they're asking me questions and I'm speaking to them and sharing knowledges and resources. And it was a very like a shock moment of like, why are these men on their knees? Like, get up and let's talk eye level. But it was a form of respect. And so when we think about how are we going to reach the communities that are forgotten or that we're not naturally a part of, to me, it goes back to how much are you willing to put yourself in a situation that you might not have known you will be in? It didn't change my faith to put a head covering on. It didn't change my faith to see the men leadership be on their knees kneeling as a sign of respect as I shared out information. It was a moment of, all right, it was a cultural competency, immediate on the spot. I tried to get on the ground so I could be eye level. My friend grabbed me and was like, no, I'll explain later, just stay still. And so it's the awareness of, okay, we're going to go with it, but mindfulness in a way of, I want to respect this population we're serving. So I lead a program called Strengthening Communities. And at this point, I will share my screen. So within Strengthening Communities, we work with community faith-based networks, or you might know them also as coalitions. My team, we also work with community-based organizations and faith-based groups. When we say hyper-local, we're going for Mothers on the Move, You can't find them on the website. They don't have a website. They're anchored in Hunts Point, Bronx, New York. They've been doing work for over 35 years. They do canvassing on a weekly basis to check in on residents to ensure that the advocacy and the rights, housing rights, are being taken care of. If there's gun violence, they're hitting the streets and they're coordinating with the other mothers, caretakers, and workers in their community in Hunts Point. And so hyperlocal allows us to create these greater currents of ripples. And it also ensures that we are in community and crevices that sometimes are forgotten, because sometimes you'll get fill in the blank organization. I won't name one just because you might be affiliated, where they're big. They're known in every state you go to. Like, we all can name one organization that's located literally in all of our United States. And that's great. What does it look like to serve those groups, though, who may not have that huge network and who may not have a multi-million-dollar budget and have people donating to them on a regular basis in order for them to be sustained? But instead, they might have one paid staff and then 15 volunteers to keep everything moving. The foundation of what the team and I do, we like to tie into the concept of building social capital, or what does it mean to be your community be resilient? I think the word resilience can sometimes be overused and abused. I think that oftentimes when we think about people who are left behind and or forgotten, they are already a people who are naturally resilient, not by choice, but because they had to be resilient, right? And so when we think about community resilience in this concept and what does it mean to establish social capital, it's the concept of Dr. Daniel Aldrich. He was a survivor of, and he experienced Hurricane Katrina, and he realized, like, the communities that got the resources fast, I mean, we know what they look like, but he dove a little bit deeper and said, they had a social capital that was very, very strong. They were linked to government, elected officials, faith-based, community-based, and private entities. They weren't just bridging. They weren't groups who just are connected to, okay, we're a Christian group, we're connected to a Muslim group. All right, we're diverse. We know what we're doing. And they weren't just groups that were bonding, like, all right, Black Christian hanging out with other Black Christians. So we really want to get all of our coalitions to the place where they are linking. And we say it can start with us, like, you're in partnership with us. And partnership with us doesn't mean top down, right? Partnership with us is we are going to walk with you through this journey together. And what does that look and feel like? So for us, we provide preparedness capacity building trainings. We do this with seasonal. So extreme heat, we'll do extreme heat preparedness. What steps can you as a leader take in order to prepare your community for extreme heat? We know in Harlem, the heat is a lot more intense than what it's going to be in downtown Brooklyn. And that will be different than what it will be in the South Bronx, which will be different than what it's going to be in the Northeast Bronx. So we know, based on climate change, based on environmental needs and infrastructural systems, we know that all people are going to be impacted by extreme heat. But as a leader, how can you better serve your population? And so we make sure we provide those trainings. We also do a technical assistance and coaching. And that means after trainings, people might want to establish a plan, and we may say, okay, we'll let you establish this plan, but here's what it looks and feels like. Here's some best practices. You know, you put it on paper because you're the owner of it. Like, we're not going to do anything with this plan except for celebrate it and share it. If you allow us to, we'll share with other people who might be asking for the plan. And then the biggest secret sauce is that we establish and develop team and community with our partners. That means we're showing up to meetings, and I don't need to be on the agenda. You have a meeting coming up? Yeah, I'll come. Okay, Miss Moriah, I'm going to put you on the agenda. No. I don't have any talking points. I just want to hear about what your community's up to, and just know that I'll be a resource. I'll bring some materials, but please don't call on me. So that when the time is for me to, hey, actually, can you put me on the agenda now? Because we want to talk about something that's really raising up and going to impact your community. Absolutely. You've been here all the time. So going to those places, sometimes we've been to community potlucks and block parties. And it's, you know, making ourselves visible so that when the emergency happens, it's not who do we look for, who can help. It's like, oh yeah, Moriah. Oh yeah, Jill. She's been around, oh my goodness, for like 8 months. Let's call her. Let's see what she can do to help us out. So we make sure we really leverage that piece. We make sure that we don't have one and done relationships. So when the emergency happens, we may not have ever had any contact in said community. When Hurricane Ida hit New York City and flooded communities that we never expected, one of my team members was like, okay, Moriah, I'm going to the Ida hit communities in Queens, specifically those of Asian descent, and more specifically, I'm looking for Mandarin speakers. And I'm not going to yuck her yum because I know right now our portfolio didn't have any of those demographics. So I'm saying, yeah, go forth. Let me know what you need and we'll go from there. So as a result, we got 5 new partners from Queens who were Ida impacted. One is a Korean-based disability organization that provides services to families with people with autism and or physical disabilities, specifically of the Korean community. We also have someone who is a multi-generational social service nonprofit that also serves the Asian community as well. So for us, it doesn't mean, oh, we only could go for these type of groups. We sometimes target groups after the emergency because we say, if we had a partner there, guess what? We would have been able to respond a little bit better. We would have been able to coordinate a little bit better. Same with the Gambian Youth Organization. They're one of our partners. And you keep hearing me say partners, and you might be wondering, what does that mean?
Emergencies happen. That's why New York City offers the Strengthening Communities program. It's open to local networks with strong community connections. Our experts help your network build a community emergency plan. And your network gets paid as it completes each step. Apply now because it pays to be prepared.
So we got to a place where we get to imagine. I get to be creative in my space. And they said, Moriah, if you had a couple of $1 million, how would you pay our community groups? Like, what could we do? And I'm like, whoa. So I put together a plan, sent it, got edits. All this was literally January of 2020 before COVID smacked us across the nation. And then someone was like, we think we might be able to get you all money, but we'll see. My executive said, Moriah, manage your expectations. This might be something in 2 or 3 years. I was like, okay, no problem. So I kept doing my work of providing trainings, going here and there, and then COVID happened. So COVID starts. It was us hosting calls on a weekly, daily basis, making calls, bringing Department of Health expert in, bringing in our partners, asking them to invite other partners for us to share like the most recent information, concerns, loop back the feedback, and then go figure by August of 2020, someone says, hey, we have some COVID recovery funding. Can your team do something with it? And we're like, absolutely. We planned for this. We planned for it when we get money. We didn't plan for COVID. And so our first cohort model allowed us to go through these 5 steps. What is a needs assessment? What template would serve you and your coalition best? How do you use a needs assessment after emergency? That's how you assess what's needed. You know, you might realize we have an older adult population and they are in need of their medicines. And they also don't have any home health care. All during this time of COVID, home health care stopped coming to their homes, and therefore their health is declining and they're not getting the meals they need. How can we fill that gap in? Oh, we have a community map and a resource directory. So let's look at that and see if any people on this resource directory or on our map are able to assist with these needs. How are we communicating out to the community? Do we have a written plan? And so really tying it into their minds, we have a thought, we have thoughts, we all have thoughts, but when you put it on paper, it seals it in a way of now anybody on your team can pick it up. We don't want just one powerhouse to know everything. We need all the other team members who are also powerhouses to know what the plan is. What are the pre-written scripts for if there's a blackout? What are the pre-written scripts for if there's a coastal storm coming? What are the pre-written scripts that allow for any type of ambiguous emergency, or simply we're having a community meeting, here's how you do it. You might have one for social media, one for texting, one for phone call banking. If you're doing phone call banking, who's leading those operations? Who's leading the approval of messages being posted on social media? Because every organization is different. What does it look and feel like to actually have a written plan to manage donations and volunteers? So often the emergency after the emergency is donations. So even that Bronx fire of January of 2022, we had to get our sanitation department about a month afterwards to go and scoop up tons of clothing and stuff. Folks were donating prom dresses. Folks were donating like uniforms, things that were not sanitized, things that were not in good shape, and things that we can't go through bags and bags of clothing, because we also have the threat of bed bugs and other things happening. So how do you manage the unsolicited and solicited donations? You know, watching the Gambian Youth Organization struggle to tell two men from Westchester County, no thank you. In the back of the pickup truck, they had at least like 10 boxes of huge diapers as well as cases of water. But in their storefront office, things were stacked so high that it was becoming a fire hazard and a danger to everybody that was volunteering. So when you have that plan in place, you're able to manage that. And then we have them put it together and have their emergency response framework for a blackout, what steps are taken, what's the call down agenda. So there's literally nothing you have to do from scratch when the emergency happens. It's them picking up the plan and just saying, okay, we're going to hold an agenda, call these member groups and make sure they come, and we got the rest taken care of. And then you figure it out on that call. So we take the groups through this journey. Again, it's the training, they get the coaching, they submit, we provide feedback, and they submit an invoice. We compensate them for this journey. After they do that year one, we don't stop there. We say now it's really important to really dive in deeper with creating that culture of preparedness. In your sustainment years and sustainment funding, we're going to give you $10,000 each year. We are going to provide you with additional trainings, but also we need you to provide trainings to your community. We need you to socialize your community emergency plan with your other member organizations of your network, right? We don't want you to be hoarders of information. We've also established what we call an extreme weather canvassing protocol. And so this is December, we used it. We had a major storm come along with the tide that was impacting Southern Brooklyn and Far Rockaway, Queens. And so we had 3 different networks do some digital canvassing, and we compensated them. It was only $4,400, right? But it was more than what they've ever gotten when someone asked them to push out any type of information. So for us, strengthening communities is about having coalitions have a structured way to plan ahead of how they're going to respond to emergencies, but also how they're going to rise and be a resource in their communities, not just with their everyday youth development, climate change, housing advocate, and yes, culture. We prepare emergency preparedness. We have that culture of preparedness. It's not a hachoo. Oh yeah, it's a, hey, we also do this. Make sure you're part of this program. You know, you can reach out to us if you need anything. We're connected. With that connection, we make sure we integrate them into what we call our emergency operations center. So our EOC is the opportunity for us to feed out information to them and vice versa. This has been a point of greatness and also a point of frustration for some of our partners because they want more. And sometimes we're not able to give more because we're simply the coordinating agency. I think my time might be up because I see Ms. Johnson's face on the camera, so I'll stop there.
Thank you so much, Moriah. That was truly enlightening. We really appreciate your talk today. We'll now hear from Dr. Henderson about emergency response approaches. And Dr. Henderson, you may begin.
Okay, thank you so much. Great to hear from you, Ms. Washington. Let me share my screen. So I am going to first talk a little bit about Dade County Street Response, and then I'm going to talk about a guide that I produced while working alongside the wonderful people at Chef in 2021 during my fellowship. So first of all, I live in Miami, and Miami experiences disasters every year. June through November, hurricane season just started, but even throughout that, it's hot all the time. And with the amount of people who are outside, especially those that are unsheltered, it puts vulnerable populations, especially and working class individuals, immigrants, and all the like at a particular disadvantage when it comes to climate. So As an introduction, Dade County Street Response was started when I was a resident at Jackson Memorial Hospital. I did my medical school at Meharry Medical College, and when I came to Miami, unbeknownst to me, I didn't even know I was going to be there. Dade County Street Response started with Stop the Bleed, in which we were experiencing a crisis of gun violence in the community for a number of different reasons. So we started with Stop the Bleed, basically teaching individuals how to bandage gunshot wounds, and then an intro to CPR. And that was the first crisis that we actually started to respond to, was through gun violence. And then after an incubator I did with an FIU medical student, we expanded our disaster relief programming. So right now, currently, we have a street medicine team, which goes out to service the unsheltered population in Miami-Dade County every Saturday. We've been out going to see the community every Saturday for the last 2.5 years. We also have a free urgent care, which I'll talk a little bit about, which the two things that really are the bedrock of those two programs are complex case management. We do education and programming alongside the University of Miami, and with multiple different specialties at Jackson Memorial Hospital, UNM, and FIU. We also do community organizing. And lastly, we have our disaster relief team, which kind of ties everything that we do, undergirds all the things that we do in our programming. So first of all, we have an MOU between a bunch of different departments at Jackson and University of Miami. And people across the country are interested in this sort of like public-private, nonprofit like relationship, especially when it comes to education, because it gives the students and the residents a different perspective than they would have had in medicine. So next, our priorities basically are programming first, education second, and then research third. And we really hope and we really know that the communities that we serve really feel that we are going out there through a programming standpoint, and everything else is secondary. So our street medicine team, as I said, operates really 7 days a week, but we go out 1 day a week in person. We have over, this when I wrote this week, 2,000, we have 15,000 engagements. We have about 800 patients. We do research, development, advocacy, mental health care, et cetera. And it was created due to the lack of coordination of services amongst the unsheltered populations. This street medicine is a new emerging topic of medicine throughout the country. I think there are only a handful of places that have it, and we're so fortunate to have it here in Miami-Dade County. Basically, it's going to the people, it's bringing things to the people, the health and social services to address the unique needs and the circumstances of the unsheltered homeless population. These are some pictures of some of our team. We have about 60 to 75 medical students at every given time that basically act as case managers and coordinators to get people access to all the services that they need. We've gotten people diagnosed cancer, melanoma on the face, and got people surgeries, and we got people prosthetics. We get people who are undocumented, documentation, and so we provide a whole gamut of services. So this is just like some overview of some of the patients that we serve, in which you think that most of these patients don't have insurance, and actually half of them do. So yeah, I'm gonna just try to skip through these just to try to give you a background on most of our services. Okay. The next thing that we have is our disaster relief team is active throughout the year. We have education and programming that is specifically focused and tailored to the vulnerable populations throughout Miami-Dade County. The main languages that we end up serving are, of course, English, but also Haitian Creole and Spanish. Dade County Street Response is also the medical arm of the Community Emergency Operations Center, which is a larger conglomerate of organizations that serve to meet needs of populations throughout Miami-Dade County and the country after a hurricane or other disasters. I want to break and really say, like, what is a disaster? And I think after COVID-19, we've seen that disasters are not just hurricane and or flooding and things of that nature. They can really be anything. And COVID-19 really was a disaster in itself. And what we see after crisis situations like COVID-19, or even the smoke-filled event that happened in New York City that spread to Philadelphia the other day as well, and it's probably still going on today, is that vulnerable populations are all impacted the same no matter what it is. And so we focused on having the infrastructure in place and having those connections in place so that we're able to respond faster than sometimes, and most times, governments are as well. And later on, we're going to talk about the Medical Professionals Abolitionist Guide to Disaster Relief that I wrote as part of the Chef Fellowship. Okay, the disaster relief team was a part of a sustainability campaign of 100 Great Ideas, in which thousands of people throughout Miami-Dade County were interviewed, and they said that they wanted to have medical professionals better respond to crises and disaster situations. So we were created out of that and incubated throughout that as well. Of course, I did my Climate Health Equity Fellowship shortly after and graduated in 2021. And we also have a University of Miami Laboratory for Integrative Knowledge team, which basically serves as a curriculum for teaching climate change through the lens of racism. And it has all different people from different specialties throughout University of Miami, because I think, as you know, it takes a coordinated effort to kind of combat and talk about climate change because it affects so many different aspects of human life and development. As part of that, we had a talk series in which we had some people who you may know throughout the country who are well known, and also locally as well, including Harriet Washington, well known in our community, the medical community as well. And then, so outside of that, we have an urgent care. It's open 3 to 4 days a week. We partner with different international subsidiaries that do direct relief and disaster relief work, like AmeriCares and Direct Relief. We are a Florida Association of Free and Charitable Clinics, and we have no liability because we're recognized under the Department of Health as a free clinic. We recently got evicted, but basically rebuilt our clinic as of last week. This is our new space. It is disaster proof, as you can see, hurricane impact, everything flood related and all that stuff. So the other projects we run are an alternative to 911 mental health mental crisis line with an organization called Dream Defenders. We also have a trauma recovery center with the Healing and Justice Center as well. If individuals are having mental health crises, they can get access to a therapist and an interventionalist if they call this number and are in a 5-mile radius of Liberty City. So with that being said, I am going to exit this and go to my disaster relief guide. So I just want to give you a little overview of the type of work that we do. And now I'm going to, yeah, there, okay. So I got a copy written in 2022. I wrote this as a part of my Climate Health Equity Fellowship. And my introduction into disasters and climate change was when, and I think a lot of other people's introduction to it as well, was when we saw Hurricane Katrina and how it ripped through the Gulf of Mexico. And not so much the disaster itself, but the response to the disaster and all of those documentaries that we've seen afterwards. It was just like, how can something like this happen in America? Of course, Kanye West proclaimed that George Bush doesn't care about Black people, but what he really was saying is that when disasters happen and vulnerable communities are impacted, our government, local, state, and federal, doesn't really have the proper infrastructure to respond to these communities in the way that they do respond to individuals who are well-to-do. And what we've seen since crisis situations since that has occurred, whether it be COVID-19 or the flooding, the deep freeze that happened in Mississippi, or even hurricanes that have impacted vulnerable populations since Hurricane Katrina, what we've seen is that FEMA, I'm going to name the organization, FEMA, Red Cross, all those organizations that get millions and millions of dollars to USAID, and we're looking at international agencies that really are supposed to focus on helping people rebuild. We look at what they did in Haiti and what we saw in Puerto Rico, where in the bottom right picture you see Donald Trump basically hurling some paper towels into the crowd. Is that they don't really know how to respond to these communities. And even though the National Advisory Council that was created after Hurricane Katrina has outlined exactly what the United States government needs to what state governments need to do in order to be better responsive to these communities, what we've seen is that they still do not do a good job. So I, created a disaster relief team. And so what I also say is that not only are state and local and federal governments not able to respond properly to these populations, hospital systems and FQHCs and these organizations that really serve the populations, the vulnerable populations, when they're not crises, tend to shut down when there is a crisis situation. And so, what I'm advocating for is something that is completely the opposite of that. So you can go to the next page. So the reason why I started a disaster relief team within the Community Emergency Operations Center is that I saw that there was needed education about the effects of climate change on health. There's decreased utilization of inpatient services during crisis triage. Anytime that if you work in an emergency room or in a facility that's still open during a crisis situation, which is likely almost always only an emergency room, you'll see that there's an overutilization of emergency room services, and that individuals who may need it, they may not even get a chance to get in and do what they need to do. And I saw that firsthand throughout multiple hurricanes that I've experienced here in Miami-Dade County. There's advocacy needed for change in public health policy on a federal, on a local, and a state level. Vulnerable populations also need education about preventable deaths during disaster. And then the equitable resource allocations of hospitals and medical anchor orgs located in vulnerable communities needs to change as well. So firstly, I want to talk about what is required. There is relationship building through mutual benefit. We shouldn't wait until a disaster happens in order to reach out to individuals who we think may need the most help. We should be constantly approaching and finding these organizations throughout the year before disaster strike. In a place like Miami-Dade County, of course, we know that they occur every June, but in other states and other local municipalities, we need to be reaching out to those populations almost on a daily basis, so that we're not left to our vices to figure out who needs help and when they need it. We want to build an infrastructure through relationship building before disasters occur. You can go to the next one. Training medical professionals to be organizers. One of the things that I think is important from my perspective, because I am a doctor, and this is one of the reasons why I created the Dade County Street Response, is because a lot of times, right now, doctors are basically employees of large hospital systems, and as such, we tend to find ourselves only entrenched into the needs of individuals who are behind the hospital doors, and that leaves the community to its vices when things happen. So I'm a big advocate of us knocking on doors, volunteering with other organizations that may be on the ground serving unsheltered populations and things of that nature, because the more that they see us, the more that they figure that they can have access to us, just like well-to-do communities do, to ask us questions, to call on us in their time of need and things of that nature as well. So training medical professionals to be outside of the hospital doors is something that we definitely do within Dade County Street Response, and connecting them to other organizations that do similar work, specifically around the social determinants of health. So right now, Dade County Street Response has coalitions with immigrant organizations, with worker organizations, co-ops, with people who serve unsheltered populations and things of that nature. We're always exchanging ideas, talking about ways to coordinate, to talk, and to cross-pollinate what we do. The other things that I think are important are investment in infrastructure before a crisis. The money aspect, I think, is really big. I think the federal government has really done a better job of trying to figure out who these disaster organizations are, and specifically target the ones that are doing, infrastructure work around crisis situations. And so there is a lot of money that is available from a climate change aspect, but more can be done in this as well as technical support to actually apply for some of these large grants. But within Dade County Street Response, the type of infrastructure that I'm talking about is that all of our programming stays alert and on and popping during a crisis situation. For example, when we activate, our street medicine team does not stop. We actually go out during crisis situations because this is when we figure out that people need us the most. Our alternative to 911 line continues to operate during a crisis situation, because we know that this is when mental health crises can increase. Our sobering center, which has just recently launched as well, will continue to serve people who have needs around substance use and substance abuse and things of that nature. And our free urgent care serves as in the Community Emergency Operations Center as the hub for all of our medical professionals that volunteer with us during a disaster as well. So these things stay on and popping if there is a crisis that does occur. I want to make sure. Okay, great. When is my time over?
We need to wrap up here shortly, Dr.
Okay,
Henderson.
great. The other thing is that I think is most important for us as medical professionals is identifying existing local and non-local emergency resources. A lot of time, as you heard from our partner Moriah Washington, is that the city has a lot of resources that they can offer to individuals. Sometimes, these populations, because of lack of investment or infrastructure or even internet or even language services, these information does not get put across to individuals. So the more that we can identify the resources that already exist, I think the better off and portray and give these things or translate these things to the vulnerable populations, I think that the better off we'll be as well. You can go to the next one as well. Establishing and engaging a strong volunteer base, which I think speaks for itself. Determining the area with the greatest need. We are very poignant in our definition of what population that we serve. We only serve vulnerable populations. We are only going to deploy if we feel as though vulnerable populations are going to be most impacted, and we speak on behalf of vulnerable populations. You can go to the next one. Okay, you can go to the next one. Okay, so in summary, the disaster relief team of Dade County Street Response is a part of a larger community emergency operations center. We connect with like-minded organizations and we prepare vulnerable populations before, during, and after crisis situations. A crisis can be anything from the smoke that occurred from Canada to COVID-19, all affect vulnerable populations the same. And so we are big advocates of building infrastructure and sustaining the infrastructure before a disaster occurs, so that when a disaster occurs, we can be better adept at responding to these communities. You can take a look at the guide and let me know if you have any questions, and thank you so much for your time.
Thank you very much, Dr. Henderson, for your presentation. I believe that this emergency response approach can serve as a model for others to implement. We've had two fantastic talks from Dr. Henderson and Moriah, and we are going to now move to take questions from the audience. I remind you that you can type the questions into the chat box and we'll get to as many of them as we can. We also ask that you please take a moment to fill out the webinar survey. The link is now in the chat. All right. Do we have any questions from the audience, Jordan, for Armen and Moriah?
Yes, we do. As some more come in the chat, I have a couple just to get us started. Really appreciate both of your presentations. And what I wanted to begin with is, as you both spoke, you highlighted both the work that you do, but more importantly, the ways in which you're going about doing your work. You both made reference to relationship building, as well as seeing community members as partners. And I wanted to begin by asking either of you, what has the community response been to your approach, engaging in this manner?
Definitely been gratitude. I had to cut it out the slides, but I had a 8-minute video with 5 different community partners just sharing and expressing like gratitude and knowing like this is just the beginning. There's beauty in intergenerational connections. And so I've worked with folks as young as 22, and I have a guy in the Bronx who's 88 years old, right? And so when I'm working with the guy who's 88 in the South Bronx and in Harlem, they're like, Moriah, we've been working with OEM for years. Nothing compares to what you are doing. And if I take a step back, it's realizing it's not just seeing, it's being. And it's like our ways of being matter, and our partners notice what patterns are consistent. And there are moments of frustration. Like one of my partners called me livid. She's like, there is a asylum seeker respite site in my community. I've been your partner for more than 5 years. Why did you not call me? There's still protocols. There's not a meaningful role for you. And as soon as you know about it is when I know about it as well. So there's not any inside information. And but I'm your partner. And I know that it's not a personal attack. I know it's frustration. And I get to articulate that frustration to my executives of like, hey, you need to get some messaging out soon. Our partners want to be a resource. Like we put them in a position to be a resource. And sometimes we might be getting in their way by not communicating with transparency. So in so many ways, it's been gratitude. And they also give very like legit feedback. Like when I started the program, Strengthen Communities, I made it where, you know, you get 40,000, but you must give $20,000 to your community organizer / consultant. And then one of the networks pulled me aside at the end and she's like, this is not equitable. And I was like, oh, tell me more. And she explained it. And I was like, I appreciate that. And I changed it. And I said, this is $40,000 for you to disperse at your discretion. Right. So like, let me not get in the way thinking I'm creating equity and thinking I'm the subject matter. I'm not the subject matter expert on distributing grants. I am a subject matter expert in making connections in community and establishing emergency preparedness plans. So for me, it's real knowing when to step up, step back, but our partners kind of mirror that as well.
Yeah, I guess I can say that because we're not like a government organization, we have a lot of leeway in which we can respond to the disaster that communities who are experiencing crisis. So far, we haven't had any complaints. You know, crises are they happen so often in a place like Florida, among so many different populations, and we just try to be a place where people can at least get information, can seek respite, no matter, you know, if the trans individuals who are experiencing, you know, the backlash from some of the policy that's going on statewide, to even abortion care, and things of that nature, which I won't expand on now for, you know, so I can make sure I don't get in any trouble. But they've been very, they've thanked us for all of our work. And, you know, of course, though, it's so much more for us. But
Yeah, thank you both for that. And I think there may be enough time for you each to answer this last question that's coming in now about Denise. I'm going to hold your question just because we'll have a chance. This question from David about preparedness guidelines for climate emergencies from FEMA, centered on an individual's capacity and or responsibility to gather supplies and resources. Many of these expectations appear to have significant assumptions about money, housing, and other resources that are less available to vulnerable or underserved populations. Do you all have thoughts on individual versus collective approaches to preparation or alternative strategies to gather supplies that are not based on individual responsibility?
yeah, so I'll answer, I guess, first, if I may, Ms. Washington. As I said, our organization, our coalition is called the Community Emergency Operations Center. And we speak on behalf of thousands of individuals who we served and have served in the past, who, you know, and we are the experts of what needs that they have, because we've been serving them over the past couple of years. On the ground, we've been knocking on doors and things of that nature. And because of that background, we approach large organizations ourselves and we say, look, this is the population that we serve, and this is what we need. And so larger international subsidiaries, as I mentioned, AmeriCares and direct relief partner directly with us. And we can directly have their ear on exactly what we need. And we have the capability also, which I think is important, to intake the stuff that we need as well. And so that's why I think it's important for communities to build some sort of capacity to do that, especially if they serve vulnerable communities. Our CEOC now sits on 1.5 acres of land. It's like 15,000 square feet. And so if we need to bring in trucks, we've sent out, supplies to other countries and to other parts of the state. And it's because we built this infrastructure alongside the local infrastructure and state infrastructure that allows us to be more nimble as well.
My short response is really, we push the community, the collective response in preparedness. So often, even when we bring up go bags, right? Like having a go bag is something that everybody on this call should have. And every person in your household and your pets should all have a go bag of what you can sustain for 2 to 3 days. We have community partners who, like us, we say it's not about money. Like, sure, each of us on this call can click on Amazon and bam, we have everything we need. Some of our community partners host go bag preparation workshops. And in that, they call it a starter kit. And then they example and model, hey, here's 6 things we got for $10 at the local dollar store. All the rest of the items that I'm showing you, you probably have in your house. You just need to dust it off. But then when we go to the next level, okay, go back, okay, got it. There's this concept of like insurance. Like, I've listened to certain executives in my agency, but everybody should have insurance. Everybody should have rental insurance. It's less than $250. And I hear that, right? And I know that that could be true for some. Not even all the people working in this agency can actually prioritize $250 in addition to all their other expenses. And so there's exploration of what does it look and feel like. We can't up and pay for everyone's rental insurance, right? But that's something that ends up keeping people unhoused after a main water break, and no agency wants to take credit for who's at fault as to why the main pipe broke and people were unhoused for over a year and a half in a hotel, right? Well, if they had insurance, this wouldn't, it's this blame game. And so what I do see is that there are housing organizations who try to establish different grants, but it's still a Band-Aid approach. There is not a permanent solution yet. And I'm speaking specifically on the city level. I try not to pay attention to what FEMA is doing, because what they do is very surface level preparedness and then recovery and pushing out loans.
Thank you so much. I know that this discussion can go on much longer, but we need to wrap up this session. I'd like to thank both of our speakers, Moriah Washington and Armen Henderson, and thank all of you for participating in our webinar series, and I hope that you found it useful. We're going to put the QR code on screen now. You can create an online account and obtain CME credit. Please use the activity code 12896. Want to remind you that these webinars are held on the second Friday of the month. The next webinar is scheduled for July 8th, and our topic will be land use. Before you leave, we ask you to take a moment to complete the webinar survey if you haven't already. The link has been put in the chat. Again, to obtain CME credit for this webinar, use the QR code on the screen to create an online account and obtain CME credit. And our activity code is 12896. We will now conclude our session. Have a wonderful day.